I'm Dr. Ramakant Deshpande, a cancer surgeon with about 40 years of experience in diagnosing and treating and managing cancers of various kinds in the Cancer Institute, Asian Cancer Institute at Mumbai. I had an experience at the Tata Memorial Hospital also earlier, and currently our group of consultants manages cancer from Asian Cancer Institute, where I manage lung cancer. Cancer is basically a disorderly, uncontrolled growth of cells which, if not treated properly in time, can become dangerous to the mankind. This is known by everybody. There is always a curiosity to know what ails us, what is dangerous for us, and that is why we will talk about lung cancer today. Lung cancer is one of the most deadly cancers where almost 80% of people who undergo diagnosis will die within the very first year of diagnosis itself. And this happens not only here, but even in the developed countries. So, let us find out what exactly causes lung cancer, what are the types of cancer, how exactly this is approached by the cancer specialist, what happens during the treatment, the side effects of the treatment, and how best can we tackle this ghastly disease. Before that, let us find out what exactly happens when you, as a person or as a patient, see your doctor. How exactly does the doctor meet the problem and how this thing is tackled? First and foremost is any doctor is going to ask you the clinical symptoms, what are the presenting symptoms. Then he is going to physically examine you, then do a few investigations, then stage the disease. Based on the stage of the disease, your line of treatment will be decided, and then the treatment will be undertaken. With great safety and security, the treatment will be executed so as you can go back to normal function as well as lifespan. Today, a girl child, if the girl child survives till the age of 5 years, the expected lifespan is up to 71 years in India. For a man, it's about 69 years. As time goes, this will keep on increasing. In 1947, when our country became independent, this used to be barely about 32 years. So the advancing science and state of economy and awareness has actually improved our lifespan, and this will keep on increasing. The most dangerous part about any malignancy is it cuts down this lifespan. So when you talk in terms of cure, when you say 5 years survival, it means that the person is not going to survive only for 5 years, but then it's highly unlikely that any disease will come back after that. The cure chances will normally depend based on your stage of presentation. So if you present in a stage 1 disease, the chances of cure are the highest. If somebody presents in a stage 4, the chances of cure are much less. The normal symptoms in case of lung are those which are associated with irritation to the respiratory tract. So a person can get cough. The cough can be productive with bringing out of a lot of sputum. Sometimes blood can come out if the disease is located in the main airways. You can have a chest pain. There could be a mass in the neck if the disease is already spread there. There could be a change in voice. There could be a mass in the tummy if the disease has spread to the liver. Severe bone pains, loss of appetite, loss of weight. These are the common symptoms which can happen because of a lung cancer. But though people have these kind of symptoms, quite often they do not really present themselves to the doctor. Why? Because there are a lot of superstitions and misconceptions. They say that, oh, I'm not a smoker, so will I ever get cancer? No, I won't get a cancer. So even if I'm sick, I will not go to the doctor. Totally wrong. Please don't do that. You don't have to be only a smoker to get lung cancer. Second one, if I go to a doctor, if he diagnoses that I'm suffering from lung, then anyway I'm going to die, why go to the doctor? Again, totally wrong. Lung cancer can be cured completely if you present yourself to a doctor in a reasonably early stage, and even if it's in a late stage, many productive years of life can be added to your life. People under 60 or 50 don't really get lung cancer. Wrong. You can get a lung cancer even at the age of 25 or 30. So anything which goes wrong with your health in the day-to-day, in any system, for more than a month, if it doesn't get corrected, please see your doctor. Very likely it may not be a cancer, but if it's cancer, then it may be an early stage with the best chance of getting cured. Smoking weed, which is like having hash, tobacco, not tobacco but ganja and all those things, will not cause cancer. Eating tobacco will not cause cancer. No, it can. Tobacco in any form can be an equally dangerous kind of a proposition. The electronic cigarettes, where there is no tobacco, they are very safe. Not at all, because they have nicotine and they can cause heart diseases. So you may not die because of the lung cancer, but you can die because of heart diseases. If you see the statistics now, about 30 years back, 80% of lung cancer patients who presented at a cancer center were smokers. Today it's only 50 to 52%. And the smoking incidence is still rising. Almost 25% of high school students in America are identified as smokers. Almost 14 to 20% of college students in India, by a survey what we conducted, we found that they were smokers. They could be casual smokers or regular smokers, but hero worshipping, seeing film stars advertising about cigarettes, though it has become less now, it actually propagates smoking in one form or the other. And what is worse, smoking incidence is increasing in women. Today it's become a fashion for girls to smoke, and mind you, a lady is always more susceptible to develop lung cancer if she is a smoker, and they do not really do that well if they get cancer stage by stage. So almost about 4 lakh to 5 lakh people every year die because of directly smoking related cancers, and these cancers are not only lung cancer but almost 12 to 13 different types of cancers. What are the causes of lung cancer in what we say? One of the commonest reasons is smoking, as I mentioned, almost the history of in 50% of people. The next one is the radon gas. This is a gas which is released during construction activity from the walls and wherever construction is going on, molding, etc. is going on. This gas gets released. It has a certain amount of radioactivity, and you can imagine that our country is a country in the making. We are progressing. What do you mean we're progressing? There's a lot of construction going on, which also means your incidence of getting cancer is also going to go up. Workplace chemicals like asbestos, nitrobenzene, and all those chemicals also can cause lung cancer itself. Air pollution, the World Health Organization says that staying in a highly polluted city like Delhi or Mumbai is equivalent to smoking 20 cigarettes anyway. So why do you want to make the whole thing worse by smoking? So if you smoke 20 cigarettes, you're already inhaling the air which is worth 20 cigarettes, another 20 cigarettes on the top of it. You can imagine the level of getting lung cancer. Genetics. Many of these cancers, about 5% of cancers are genetically propagated, which means that there is some problem with the genes, and even if you are not a smoker, even if you are not an old man, even if you don't have a definite causative history, you can develop cancer. Past history of radiation. There are people who will have taken radiation for cure of their lymphomas, breast cancer. That makes them more susceptible for developing of lung cancer itself. Inflammatory lung disease like tuberculosis, viral infection also makes incidence much higher. So, mind you, the average incidence of lung cancer, what is found at the highest level, in case of United States in the 60s. But in India, we find that it happens when the men are still in 40s and 50s. More number of men suffer from lung cancer. And when they suffer from lung cancer, they are still the pillars of their own family. They have young children, they have a wife. Quite often the wife may or may not be working. So the effects can be very, very deadly. The social effects of the whole problem are made much worse because many of us don't really take care to take health insurance where any kind of a serious disease is going to eat into your saving. So this is another thing apart from do not smoke, be careful about health, please have a health insurance is going to be my third advice. But it's not only in the smokers that the danger is there. The occupational hazards like in miners, etc. exist even in non-smokers. Asbestos danger exists in non-smokers. Environment, etc. is still there. Pollution is still there. So all these factors which cannot really be changed are to be remembered, but what you can actually change is your own habits and your own ability to live healthily. So once you have developed these symptoms, once you go to a doctor, the doctor is going to run you through some diagnostic check apart from physical check that they have done. If you have a lymph node or a mass anywhere, they will take a biopsy out of that. But otherwise, a routine chest X-ray will show if there is a lesion in the lung. A CT scan will show the exact size, extent, relation with the surrounding organs. A PET CT scan will actually show if at all it has spread elsewhere, and the bronchoscopy will confirm the presence of a lesion from where you can actually take a biopsy. The biopsy, without a biopsy, we can't really treat a malignancy of any kind. So a biopsy can be done either through a bronchoscopy or a CT scan guided biopsy. Both can give us adequate tissue so that they can actually confirm the diagnosis of the malignancy. Apart from confirmation of a diagnosis, what is relevant also is when you get a tissue, you can run some genetic testing. For example, if it's an advanced kind of a tumor, where it has already spread to the liver, to the lung, etc., then you can run some genetic testing, the mutation testing, where you can identify if at all there are any targets to the cancer cells which we can use in treating by tablets or injections, which is called targeted therapy, and then very easily we can prolong the life of a person. You may have a disease, but you can live for many, many years. There was a time when 30, 40 years back, when I started my career for a stage 4 malignancy, the average survival used to be about 5 months, and we used to tell the person to go home and get lucky, spend time with your family, we used to say. Today, that is not the situation. We can give them 5 years, maybe 10 years. Even in a stage 4 malignancy, what is happening now is that the modern scientific development, cancer, if it is not curable, is being converted into a chronic disease like diabetes or hypertension, which cannot be cured, but you can control them for a long period of time. So even if there is an animal in your hall, in a living room, the animal is going to be put into a corner as a quiet kind of a dog sleeping. So you have your disease, you have an evidence of a disease, but it is not likely to kill you. But for that, you need to reach your doctor, you need to get investigated, and the disease has to have a target therapy itself. Certain investigations give us immense information in treating. MRI of a spine, if it is required, will show how far the disease has locally progressed and what are the areas that what we need to excise. PET CT scan will show if at all there is a spread beyond the normal possibility and if the stage actually has really changed. Once you do the biopsy, the disease is classified into two basic types. One is a small cell, another is a non-small cell. Small cell disease, these are biological, the morphological characters of the disease based on which this diagnosis is made. Small cell tumors present themselves as small rounded cells which are very uniform kind of a picture, but they are very aggressive. It's more like a localized manifestation of a generalized disease. You try to treat them by a local modality of treatment like only radiation or only surgery, and you'll find that the disease will spread within a month or two everywhere. So you need to treat them differently. 85% fortunately is non-small cell lung cancer, which can be divided into adenocarcinoma, squamous cell carcinoma or large cell carcinoma, which actually starts at one location, spreads in a contiguous fashion into the surrounding organ or surrounding lung, or it can go into the lymph node through the bloodstream. It can go actually elsewhere into the distant organs like the opposite lung, into the bones, into the brain, into the lung, into the liver, etc. But it happens in a very stepwise fashion. So for it to reach from stage 1 to stage 4, sometimes it can take 2 years, sometimes it can take 5 years based on its own level of aggression. Mind you, all lung cancers will not behave the same way, and they can behave completely differently in two different individuals. So one person may take from stage 1 to stage 4 a passage of only maybe about 1 year, another may take about 5 years. This is a biological behavior of the disease and based on the innate resistance of the individual. So the best thing is to see the doctor as early as possible the moment you have any problem. So after all this awareness, after all this knowledge what we have, it is not more than 30% of patients who walk in with a stage 1 or stage 2, even in our clinics what we see. Almost about 30 to 40% are locally advanced, which means that the disease is already spread to the lymph nodes. where actually the cure becomes a little more difficult rather than aggressive treatment. And in case almost 40% are in stage 4, where we can't really target them to cure them of their disease. The disease cannot really be completely eliminated, but we can add a lot of life as well as a few years to their life. So once we have decided that there is a non-small cell lung cancer, then based on the extent and the size of the disease, we normally decide that surgery would be the line of treatment if the patient is fit. So the patient undergoes multiple investigations for assessing fitness. So you have blood investigations, you have lung investigation to check the strength of the lungs, whether if I remove a certain portion of the lung, what is going to be the residual lung function? Will that support that person's body to take the person into a normal level of activity or not, is what is assessed by all these investigations. Whether the heart will be able to bear this kind of an exercise. Anesthesia of 2 years, 3 hours. Sometimes it can take about 4 hours or 5 hours for a surgery. So will the person be able to tolerate that surgery and undergo rehabilitation therapy or not? So all this is done by extensive preoperative investigation. Once the assessment is done, then we do optimization, which means that somebody whose lung function may not be good right now can be improved over a period of time by giving physiotherapy. We put them through a very, very strict, rigorous kind of a schedule of inspiratory spirometry, that is breathing exercises, balloon expansions, coughing out all the cough, and so on and so forth, and improve their lung functions over a period of 1, 2, 3, 4 weeks, and then we operate that particular patient in a designated kind of a period. Some of these tumors are fairly large, where the tumor size is not really ideal. If you operate at that particular time, you may need to take a very large portion of the lung, or you may not be able to take out the entire tumor at all. So what you do is you give them chemotherapy, preoperative therapy, either a chemotherapy or a combination of chemotherapy and radiation therapy to make them smaller, more manageable. Surgery becomes easier and radical surgery becomes more possible. So that will be a combination kind of a therapy based on the staging and assessment of the patient. So on one side it is primary surgery, on the other side it is what we call a neoadjuvant, like preoperative chemo radiation therapy followed by surgery. Extent of surgery will depend upon the size of the disease, location of the disease. So it could be taking, in a very old man, if you have to take only a small portion, it is called a wedge resection. It could be, we could be doing a segmental resection where there are 19 segments in both the lungs together, so only one segment can be taken out, or lobe will be taken out, or an entire lung will be taken out, along with all the spread in the lymph nodes. So the extent of resection will be decided by your expert. So it's always very important to choose a center which does this surgery regularly, and choose your panel of consultants who do these kind of surgeries very regularly. The more you do, the better you become, so that your risk of the whole treatment goes down, risk of getting into complications or a possible death also goes down. And that is why you say that please choose your expert panel very carefully. Fortunately, in our country, you can reach a major center which is experienced in these kind of treatments within 200 kilometers from any place of residence in this vast country of 138 crore people. It is perfectly possible to do it, but only thing is you have to be careful in choosing that particular center. This is very, very important. So traditionally it can be surgery, primary surgery, chemotherapy, either before or later on. It adds to the combination. Surgery contributes to almost about 80% in case of cure in early stages. Chemotherapy will add about 10 more %. Radiation may add about another 10% to all these efforts. So it's all a combination kind of a therapy. What happens if the disease has gone out of the limits of cure? If the disease is already spread, you can't keep on operating at 20 different locations and expect that the patient will get cured. Why is that so? When you have a spread elsewhere, it means that there's a presumption that cells of the tumor are already circulating in the blood. So even if you take out those visible pieces of tumor, the cells in circulation will land elsewhere and they will show up immediately as soon as your healing is complete. Lung surgery of any kind, where you involve the opening of the chest wall or even an endoscopic surgery, is a matter of major concern. Takes almost 1 to 3 months for complete recovery, and if you have operated on a wrong level of patients, you can have a recurrence in about 3 months. So you have achieved practically nothing. So what we do at that time is we test those tumors whether they have certain target, genetic mutation targets called EGFR, KRAS. All these things your doctor will be, medical oncologist will be able to explain you very clearly and in detail in a language in which you understand. So if the targets are present, then you can actually shift over target management, and then only with tablets the whole disease starts shrinking. It may completely disappear in many percent, almost 20% of patients. It may become smaller in about another 40-50% of patients, and it will become smaller, but it will still be visible in almost about 20% of patients. But in essence, your life will definitely get prolonged. Same way, now the latest kid on the block is immunotherapy. If your tumor shows that it is susceptible to immunotherapy by testing what we call as a programmed death ligand, a PDL1 testing, then in which case we can actually give medication. What it does is it trains your own immune cells. This is like training in a city. You are training your own police or your civil defense people to a level of equivalence of an army and navy and air force. To that level of fighting ability you are training them, so that those cells will control the disease cells, and then the life can actually be prolonged. And the beauty of giving immunotherapy is, if it shows that your disease can be controlled over a period of 2 years, that's the time that it may be required to be given the treatment. Rest of the time, you don't really need to give treatment. Your body learns by itself. So, there are several drugs, both in genetic as well as immunotherapy, which can actually be used for prolonging life. So what we do now as physicians, as surgeons, as oncologists is we combine all these weapons in a mix and match. We can combine surgery with chemotherapy, with immunotherapy, with genetics in various sequences, with a complete target of improving an overall survival, improving an overall quality of a human being. So this is a major exercise, and mind you, a complete cooperation and complete compliance of the treatment is absolutely essential. So it is very important that your family physician who lives close to you, your entire family, you yourself, the consultant panel, everybody is in unity in fighting this kind of a deadly disease. So single treatment, either surgery or a combination, or non-surgical treatments are the various options. Surgery continues to be the gold standard for curing early stage cancer, and this disturbance of the chest, I'll speak to you about surgery just now, but it leaves a fully functional patient only in about 2 to 3 months. Till that time, patient keeps on getting adjusted to the recovery period of the patient. You can see here that surgery can be done in various forms. We can actually have a very large incision on the chest, reach the lung, remove the lung by special techniques using what we call as staplers and special harmonic scalpel, so on and so forth, based on the extent. Or we can do it minimally invasive with small openings, almost small openings, where you can actually do the same surgery. This is equal to eating food with either your hand or eating it with fork and spoon, but the surgery will remain the same, extent of resection will remain the same. It is natural that such a invasive kind of a attempt for curing you will automatically have some amount of pain, minimal breathlessness on exertion, hiccups, etc. for some time, maybe 1 to 3 months, but then you become absolutely all right after that. Very rarely complications like bleeding, etc. can occur, but these complications are very, very few if you choose a very well experienced kind of a team. Chemotherapy can cause loss of appetite, it can cause loss of hair, pigmentation, itching, all are reversible and treatable kind of problems. Same thing can happen with targeted therapy, with loose motion, skin rashes, itching, thickening of nails, etc. completely reversible. Radiation can cause minimal breathlessness, pigmentation of the skin, again very tolerable and almost reversible. Immunotherapy rarely can cause jaundice, minimal breathlessness, skin reactions. Mind you, 90% of people will not get any kind of major side effects. But when a person is telling you these side effects, it appears as if these are very major obstacles. If these were very major obstacles, the doctors would not have used these methods of treatment. So there is a certain amount of level of confidence that is required between a patient, the relatives and the doctors. And the doctor will completely explain you, and he will also tell you about what is the relative percentage. Jaundice is seen in about 3% of people, which means that in 97% there will be no major kind of side effects. After we do all this, what are we doing this for? As I mentioned, to bring the person back to a normal level of cure, which means that if a patient has undergone treatment at the age of say 48, what are his chances to go back to the normal lifespan of 71? That would depend upon, one is the original stage and the successful completion of your treatment. In case of stage 1A, the percentage of people who will go back to the normal lifespan will be almost about 92 to 97%. In case of stage 2, it does go down to almost about 50 to 60%. In case of stage 3, it can go to 30 to 40%. In stage 4, by surgery, only about 4 to 5% of patients will reach that level. But when you combine this with targeted therapy, if any, we can find that the overall survivals can improve even in stage 3 and stage 4. So that is the beauty of advances. So when things are so difficult in treatment pattern, why don't we really reverse the whole thing and go into preventive aspect? So best thing is to avoid tobacco in all forms, eat healthy, avoid or minimize alcohol, continue doing good exercise. Mind you, even passive smoking is very bad. If you are smoking without concern, please remember you are subjecting your child and your wife also to cancer. Extremely important. Not only that, if you don't have ventilator in your kitchen, if the smoke is actually circulating in your house, that also is a causative factor for lung cancer. This is very, very important to realize. Exercise improves lung function. Do that. It's always better. Avoid polluted areas. There used to be a time when people used to smoke. You go to a bar, to a hotel, and it would be full of smoke. Fortunately, now governments have started making smoking a banned item, and we don't really find smoking in common areas anymore. And do not forget regular check. After doing all the things, this is like meeting with an accident. You can actually take all the precautions. Somebody else can cause an accident to you. So best thing is get diagnosed in a very, very early stage. So what do we do now? In case of advanced countries and in some areas even in India, what we do is we incorporate what we call as a low dose spiral CT scan in your regular checkup. Many of us, thousands and thousands of people undergo executive checkup. They undergo blood tests, they undergo cardiac check, etc. And they just undergo chest X-ray, which should actually be substituted by low dose spiral CT scan, which costs only about 2,500 rupees. But in about 3 to 4% it will show an abnormality in the lung, and in about 0.1% it will turn out to be a lung cancer. So if we do a preventive low dose spiral CT scan, particularly if you are a smoker, if you are more than 55 years of age, these are all high risk kind of groups. So your chance of early diagnosis will be far, far better. So in case of US, they have shown that the death incidence because of lung cancer has been brought down by 20% by sheerly doing low dose spiral CT scan over a period of every year, over a period of 3 to 4 years. We normally do this till the age of 75. So it doesn't prevent lung cancer, but it helps diagnosis in a very early stage. And as I mentioned, in case of stage 1, your cure chances are more than 90%. After having done all this, is it that you have finished your treatment and you walk away into the sunset very happily? Not really. You still have to undergo a regular checkup. In the first year, it's like once in 3 months. Next year, it's once in 6 months. And then once a year for at least about 5 years. Investigations are done like chest X-ray, maybe CT scan once in 6 months, PET CT scan once in a year, etc. And during this time, the moment you finish your treatment, please remember that tobacco is a no-no for your rest of your life. Integrate good nutrition, integrate exercise, deep breathing exercises, regular follow-ups, and vaccinate yourself against respiratory infections. The current COVID kind of an epidemic also is one of the respiratory infections, as is what you can see, but even influenza, and other infections, you should have vaccination against it regularly. Mind you, bad atmosphere and repeated respiratory infection can be as deadly as smoking. So that's why you have to take care of your own health. Be aware of it. Have the umbrella of an insurance, but please take care of your health. And that is exactly how we can actually fight this scourge of lung cancer. Thank you.